Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about acuity based patient care and the amount of nurses we allocate by assessing skill mix competency for safe care, and also it helps optimize manpower utilization. So for this discussion, I request all the speakers in the panels to introduce one by one, and it is our privilege and we are honored to have you all here in this discussion. Firstly, we'll start with Shivani. Over to you, Shivani.
Yes, ma'am. My name is Srivani. I'm Indo-American Cancer Hospital and Research Institute. I'm a nursing superintendent. Ma'am, it is a good privilege to be gather in a webinar. And then my topic is patient acuity-based patient care. In this, actually specific and verify the needs and the complexes. Whatever it is there, the prioritizing the patient based on the severity of their illness and their required nursing care.
Yes, thank you. And yes, Dr. Vijay, we'd like to hear from your end as well.
Yes, ma'am. I'm very happy to be part of this webinar, which is a very interesting and also a new topic. I'm working as assistant professor in ESIC College of Nursing, Bangalore, Indranagar. Thank you, ma'am.
Yes, and in this whole lot of discussion, I think Shweta is very important as she is the bedside, nurse. Yes, Shweta,
Good
over to you.
afternoon, one and all. Good afternoon, one and all. My name is Shweta. I'm having MSc Nursing, OB Gynecology specialty. I'm presently working as a nursing officer in ESIC, Sanat Nagar. I'm working bedside with the patients.
Yes.
Thank you for giving me this opportunity.
Thank you so much for your very crisp introduction. Yes, we are going to understand about this acuity based patient care. I know this model has been practiced by every hospital. So yeah, and before NABH accreditation or JCI accreditation, we didn't know that this model is also to be practiced for the safe patient care. Yes. So firstly, we like to understand what is acuity based patient care. Yes. Firstly, we like to understand from Shivani in very short. This session is going to be very time bound. Yes. Over to you, Shivani.
Yeah, ma'am. Acuity-based emphasize the intensity of the nursing care required the each individual, ensuring that the right patient and receive the right care from a nurse with the appropriate skills.
Yes.
Yeah, it is the normally classification system is the acuity tool is the to objectively categorize the patient and score their care needs. Actually, this is the score will be the stable is the 1 to T4 high risk based on the severe indications.
Yes. So the score patient scoring system as well the allocation of level of nursing staff for these patients are very important. Yes. Shweta, we like to also listen from your end. Do you practice this model of distribution at your setup?
Yes, ma'am. We do practice this, and patients are allocated based on the experience. The staff who are having more experience are given the critical patients, whereas the juniors, the student nurses, they will be made to help the senior nurses, and the allocation will be done based on this. And this will also help us to reduce the workload. It will help us to reduce the influence the resources. It will facilitate the personalized patient care, and it will also serve as a quality measurement. So this helps in overall.
Yes. So when do you call the nurse as a fresher nurse? Like what is the time period you define the nurse as a fresher nurse? Like for government protocol, I want to understand, Yes.
Ma'am, for government protocol, there is a probation period, ma'am, for 2 years. But actually, the nurses who have completed from till 1 year, they are freshers, ma'am.
And they can be assigned to the complex patient as well.
Yes,
yeah, very great insight. Yeah, very great insight. Yes. Again, we would like to understand from you, like why practice this model of care and resource allocation, especially for large setup ICU or the ward, because as you said, you are working with a 30-bedded surgical ICU, at your setup. Yes.
Yes,
what does it, what does it has to say? Yes.
With this acuity-based patient care, we have effective staff utilization. There is right response to the patient care. There is enhanced patient satisfaction and outcomes. Patient safety can be maintained. Not only that, it will have we can give high quality care while managing the cost. Balanced nurse patient will not only decrease the workload, it will give job satisfaction to them, empower the nurses to deliver higher quality care. There will be good communication between the nurses and the patient safety, we can minimize patient incidents will be minimized. So higher satisfaction can be attained with this care, with this type
And
of
I
care.
think every patient in the healthcare industry and in the tertiary care centers, they always like to have the response, right amount of response. Time-bound response is very much important because anytime patient faces anything, firstly, what the patient does is just likes to, communicate with the bedside nurse. Yes. Going ahead, we try to understand, we'll also understand from Vijaya, who is able leadership for, her college, like who decides the patient acuity and nurses allocation based on patient conditions. I think, do you think there is a leader or a senior nurse nowadays because of the attrition and overseas, lot of benefits, not lot of Indian nurses are just reaching to overseas. Yes. Over to you for your insight, Vijay. Yes.
Yes, ma'am. Thank you. So it could be done by the nurse in charge or the shift senior nurse who is present in the ward, or a trained
Yes.
nurse should be there for the allocation. And also it can be done shift wise or as needed based on the need arises, it can be done. And the
Yes.
responsibility of assigning these patients depends on the nurse in charge and their senior nurse on the duty and their experience in doing so, in handling
Yes.
the emergency as well as the critical care needs. In some
Yeah.
cases, any nurse who understand the patient can also do the acuity allocation, because if no one is there, they have to take it ultimately. So that also can be done. And the patient assignments are need to be reviewed at the start of shift and also modified in between if required, and should be checked like every shift to see how it
Yes.
is done,
Very.
how it is
Yeah.
going, like that, to have it over it. And this will help us to ensure the real-time adjustment of nursing care according to the patient care needs.
Yes, I
Yes, what?
appreciate the word you have used, real-time adjustment. Yes,
Yes, ma'am.
it requires sometimes. Yeah. So, Shweta, what kind of cases when you receive as a new admission or transfer in, sometimes ratios goes a little higher. Like
Yes,
morning,
ma'am.
maybe you assigned a nurse who was, 1:4, like one nurse had four patients. And
Yes,
so
ma'am.
too by mid-morning, the number goes higher. So,
Yes, ma'am.
what is your insight on the same? Do you practice? Or do you
Ma'am,
call for the additional help or vice versa? Yes.
yes, ma'am. Periodical checks are done, ma'am. We have senior nurses who will be monitoring our care, and if suddenly there is a transfer in or transfer out of the patient sometimes, for example, aneurysm patient, the GCS fluctuates. So at that time, what we do is we ask help from the senior nurses. If they are able to help us, they will help, or else we will get help from the nursing office. We'll be just informing them about the care. Then they will be allotting sufficient staff. They'll be sending extra
Yes.
staff for the care, so that patient care will not be hindered.
Yes. So I think that is the reason we have a senior nurse managers or nursing supervisors on duty who will always take the rounds and try asking the occupancy versus manpower allocations. I think yes. Yes. So yeah, going ahead, what if the nurse in charge faces difficulties, while assigning patients due to shortage or absenteeism, or maybe similar skill level nurses are not found in a shift? I think this is a very great challenges which we keep experiencing the same. I think yes. What happens at Indo-American setup? Yes, Shivani, over to you.
Yes, ma'am. In case of staff shortage or nurses with similar skill sets, like skill matrix, it is a
Yes.
complex. No, in skill matrix, we are seeing the from junior to the senior level and different department categories. We are delegation, constant communication with the flexible workflow model. We are giving the
Yeah.
priorities in the patient needs. Actually, the triage patient by acuity, immediate
Yeah.
care to the high prioritizing care. It is a high prioritizing intermediate care, and then new admission, unstable vitals, and then
Yes.
whoever is requiring the special procedures like chemotherapy, like. we have a prior patient acuity and balancing the high, low, and acuity cases. Shortage. See now, many as a leaders, we have a challenge nowadays.
Yes.
Absenteeism is a more, and then it is the skills what have
Burning issues.
oh
Burning
yeah,
issue. Yes.
it is a burning issue. We have to that skills. It is a more workload is keeping to the other nurse. It the outcome will be the quality will be very low. So
So
the
that is the
challenge
reason I think we have a reserve pool. Now you see today is a post Vinayak Chaturthi day today, post festival day, and we may see. I mean, in generalized way, I'm trying to say, like we may see few nurses who have not turned up due to this again. Having a reserve pool can be just utilized. Yes, and yes, and I think yes, experienced and fresher nurses mix also can be seen in the pattern. Yes. Yeah, and should this document, I mean, this is a kind of model and document or register. We have the printed registers. Should this document be audited or validated by the in charge or the shift senior nurse to match a nurse-patient ratio? Because, yeah, you are in the admin category, but sometimes, we always expect nursing supervisor to go on round and check, whether NP ratios and clinical condition of the patient is safe or not. Yes, Shweta, what do you practice in your setup?
Ma'am, we have periodical checks, ma'am. Nursing supervisor, nursing staff nurses who are present, senior nursing officers, they will be monitoring our works. Along with them, nursing supervisors who will be from nursing office, they will be also validating our work, ma'am. The patients also, if they are satisfied, they can give a feedback through the app. There is a Santosh app in ESIC web portal whereby they can give directly whatever the feedback they want to give, the patients can give themselves. Otherwise,
Yes.
continuous auditing will be done by the senior nursing officers, nurse in charges, and the nursing officer.
Yeah, I
These
think
people
by
will be
validation, you
responsible.
can always, yeah, by validating, you can always understand the gap. Whether,
Yes, ma'am.
fresher nurses or 0 to 1 nurses were given which kind of patient and 2 years were given. This analyzation is very important. Yes, Dr. Vijaya, what you have to say, like, do you feel that nurses or students will be very accountable and we can see their performance, etc.? In short, yes. Over to you.
Yes, ma'am. Yes, yes. This patient and nurse care allocation should always be validated by an in charge or a supervisor to keep the things on record, as well
Yes.
as whether it is going properly. That is for an ongoing evaluation, and the validation ensure that the patient safety is not compromised at any cost,
Yes.
and that care standards are being met by the hospital and by the nurses, and it also provides accountability for the nurses and helps in monitoring their performances and giving the patients confidence that they are being cared for properly. This is very
Yes.
important because earlier we had a concept like the patient should recover and go from the hospital, but now we are bringing in the concept patient should go after recovery and happily. So this is what we are
Yes.
doing. So for that, it is very essential. And
Yes.
regular auditing also helps in continuous improvement of the staff practices as well as increasing the quality standards of the hospital also. So I
Yes.
feel
Yes. As right, a very valid point you said, validation and checks will always drive us, better. Yes. Yeah, going forward again, like, yeah, this is a little conflict type, insight I am going to ask Shrivani. Yes, should healthcare industries have an equal number of nurses with a different skill mix to provide personalized care? Yes, I think, yes, this is a very challengeable, but then, yes, I like to understand from you. We all like to understand from you. Yes.
Yes, ma'am. This is an equal skill mix is not ideal for personalized care, ma'am. Why
Yeah.
means an equal distribution of skill level means 1:1 ratio of juniors or intermediate and senior nurses fails to account for varying the severity of the patient conditions.
Yes. So
So,
balancing the skill mix, you mean to say, you should always have the balanced skill mix. Like
yeah,
you
balance.
can have BSc, you can have diplomas, you can have, in OPD areas. Yeah, right.
Now, example
Yes.
OPD means ANMs
Yes.
according the skill.
ANMs, yeah. in the other sectors, we see ANMs or GNM diplomats, they can always take care because see, diagnostic areas are also very crucial where, we have to have a nurses who can communicate and assist while the patient goes for non-invasive procedures as well. And female clients are again very important and crucial for us. Yes. Yeah, it's training. I mean, training needs for these nurses right from the student period solve this problem, Dr. Vijaya, because I know, yes, nowadays this is the era where we are trying to train all the student nurses bedside. If you see at our facility, right from the first year period, right from the college, I mean, the curriculum based is different, but then again we try. Training our nurses right from going to the college. Our educator, they goes into the college. Our director's focus point is also the same. Yes. So over to you. What is your insight on the same?
Yes, ma'am. Training the student nurses from the stage from first year to fourth year is the right approach because often there is a gap between what is taught in the theory and what happens at the bedside. Early
Yes.
training helps helps to close these gaps by giving the students a real experience in the clinical settings by taking up care study presentation, care plan presentation, or 5 minutes presentation. That would be very much helpful for the patient to link the theory with the practice. And our competency based syllabus, the INC syllabus, which has come out now and which is running in practice, is very well covering all these things. We are competently preparing the students with OSCE and OSPE. With that, we are trying to build the bridge the gap.
Confidence and critical thinking. Yes,
Yeah.
yes.
And also it
So,
enhances their confidence and it makes them to practice ready for from the very beginning of their
yes,
careers.
yes,
That is the novice nurse to the expert things. On the
yes. So that
long
they
term,
are,
it gives a very good performance.
yeah, so that they are very confident in facing real-time challenges right from their,
Yes, ma'am.
fresher period.
Mm.
Yes, very valid point. I think,
Mm.
yes,
Yes.
this topic is not enough. I think we can speak a lot about this topic because we are only trying to talk about patient equity based, but we are, skill mix also is a great subject about the same. Yes. Yeah, going ahead again from Shweta, we like to understand because I think you can also tell us, what are the benefits? I know there are conflicts as well. You got to tell me few benefits which you all face. Like it gives a happy feel too for you guys. Like because you all are bedside. Yes. What are the benefits you like to quote here? Yes.
Yes, ma'am. There are many benefits with the Acuity, ma'am. First, there is increase in the employee satisfaction. The retention of the staff nurses will be more. The work will be decreased. There will be the experienced nurses will act as mentors, and the juniors will develop confidence. So there is better
Yes.
operational efficiency. There is a cost saving. It will decrease the mortality and adverse outcomes like infections, falls, and pressure ulcers, because nowadays patients, they have become more well versed with medical terms, like they
Yes.
google it and they expect complete care from us. So
5
if we are
minutes.
not
Yes.
able to give the care, then there will be questions. So we
Yes.
have to provide if we want patient satisfaction, we have to provide complete care. So if care is based on the acuity, based on the need of the patient, tailor-made care, if we say, that is a more appropriate word. Tailor-made care has to be given to the patients for their satisfaction. And most
Yes.
critically ill patients, if they are given to the experienced nurses, they will be identify the early warning signs which are present in the patients.
Yes.
So
Yes.
priorly we can identify and we can give appropriate care. Because sometimes if
Yes.
doctors are not available, sisters has to take decisions and they have to provide care. Okay, so
Act
in that
promptly.
situation,
Yes.
act promptly
Yes.
and a life has to be saved. So it
Yes.
will not only be beneficial to the patients, but also it will have increased employee satisfaction and retention.
Yeah, there will be few conflict as well. Since we spoke about the benefits, what are the conflicts which you get to see? Not all the nurses are happy for the, maybe today you were looking after 201, 202, 203, and next day also you are given the same assignment. I think same assigning the same patients gives a lot of, the nurses are also very comfortable because they know the case, and they are very well versed with the attenders. They can communicate. What happens in real conflict situation? How do
Yes,
you
ma'am.
tackle it?
For
In short.
example, ma'am, like if we have a patient with tracheostomy and if every day we are giving the same nurse to the patient, then what happens is the nurse, sometimes because of repeated suctioning, she might also develop upper respiratory tract infection. So she is very, she feels very bad, like only I am being burdened, overburdened, or only I am being given the extra patients, extra care is given to me only. And junior nurses, they have to do other works. So to reduce this, acuity of patient care is very much essential, ma'am. We have to share the work. We have to
Yes.
include even the student
Effective.
nurses
Yes.
in the simple care procedures. Even student nurses can be involved in order to minimize the work, so that the
Yes.
nurses will not be overburdened. They will not feel
So,
bad for the care, ma'am. That's all.
and nurses can focus only on the core fundamental
Core
nursing care towards the patient. Yes. And if a patient likes to select that nurse only, that particular nurse, XYZ nurse only until the discharge, what do? Do you assign the same nurse until the discharge? Sometimes
Mm.
yes. Yeah,
Sometimes yes, ma'am,
sometimes
but
yes.
maximum, like we try to talk with the patient, ma'am, like what is his concern, why he wants only that particular nurse. We try to identify, we communicate with the
Yes.
patient and try to identify what he expects from us, so that we will be
Yes.
able to provide him. Even the nurses are also communicated about these needs, so that even they will also be able to help the patient.
Yeah. So, yeah, very valid and practical tips you have provided to us. Yeah. So now again, I think we have come to the end of the discussion, and this is again for your insight, Vijaya. Does on-job training or clinical, bedside training for student nurses, like case presentation, assigning cases under the supervision, helps for the students? Yes. What is your point for the same, and what is your practice at your facility, at your
Yes.
institution? Yes. And what is your
On
ratio? Yeah.
on the job training for the student nurses plays a vital role in preparing the students for the real world challenges, actually speaking, where the classroom teaching provides only theoretical knowledge. It is
Yes.
during the on the job training the students will get a chance to apply their knowledge to the actual practice. And through the CRACE presentations, clinical postings, and mentorships programs, students are exposed to the real time challenges, and they also learn the bedside protocols such as medication administration, patient monitoring, and infection control protocols, and how to handle the patient during emergency situations, all these kind of
Yes.
things. When they work under the guidance of the seniors or mentors, it is ensured that the students are not left alone when there is a difficult situation. And
Yes.
this supervision gives them the confidence to handle the patients safely, and while also learning how to manage unexpected clinical events. And
Adverse events. Yeah.
additionally, the experience also helps them to develop the problem solving skills as well as adaptability. So improve their critical thinking also in all the ways.
Yes.
And over time, the students gain independence and become more competent, and that will improve their professional growth, and it also improves the patient care quality what the hospital offers to that. So that's
Yes.
all my opinion.
Yes, yes, very valid opinion. As we also practice this, core fundamental policy, like the student, whenever they come to the clinical, exposure, and wherever they are posted, we try to again reassess them and post the nurse student once they get into the payroll, and same, clinical posting we try to give them. Like if a nurse was clinical hours she finished in NICU, she will be again continuing with the NICU care itself, so that they know the protocol, communication is important, every other activities are taken care. Yes, I think this was not enough for us to discuss. I know we can go on talking a lot and lot about this, because it's a very very complex protocol, which sometimes it is done properly, sometimes we need to always remind the in charge nurses. And nowadays in charge nurses are only 2 year 3 year old, but they are very smart enough in distributing the cases as well. Yes, I like to thank everybody for your very valid, presence here, and we will try connect further. And thank you so much for your valuable time. Yes, we end
Thank
the
you.
session.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank
Thank you
you.
for the
Thank you,
opportunity.
one and all, ma'am. Thank you for this opportunity. Thank you, ma'am.
Thank you.
Thank you,
Thank you,
ma'am.
Shivani. We'll connect since we are local, me and Shweta, and we invite Dr. Vijay to come and visit our facility so that we can,
Yeah,
look for many more other, good practices. Yes,
sure,
we
ma'am.
end.
Sure,
Thank
ma'am.
you.
Thank you.
Thank you
Sure,
very much.
sure.
Thank you.
Thank you.
Thank you, ma'am. Thank you, Srivani, ma'am. Thank you, Sweta, ma'am.
Okay, ma'am.
Thank you, Shanti ma'am, for giving us the opportunity.
Thank you.
Thank you, Shweta.
Thank you, ma'am.
Thank you.
Ma'am.
Thank you, Vijay ma'am. Thank you, Srivani ma'am.